Speaker, during your speech, you were saying that you wanted to fund the governor's environmental proposal and other initiatives while lowering per capita spending overall. And historically, the House has done that, or lawmakers have done that by cutting from healthcare. But I haven't gotten the impression that you're going to cut from Medicaid or anything like that. So how are you going to manage those two things?
Well, we're working all that out now, but we think that there's a lot of spending in the budget that is unnecessary spending. And so part of crafting a budget is not taking for granted that everything that was done before should be accepted as much, and then we should add all these new dollars to the initiatives that we want to do now. So we've gone back and we're looking at everything and make sure that everything can justify its existence. And what we're finding, I think, is that we're going to find plenty of dollars to be able to still fund those priorities and still come in below per capita.
Do you have a target number? Have you got, since you use stats, so I'm assuming that you have a per capita number in mind. So then do you have a target number in mind as to what you want to reduce the overall budget by?
You know, honestly, the real target is to be below last year's per capita spending. The exact number, we're not trying to fix. What we're trying to make sure that we do is that we spend less money per resident than we did last year. We think there are economies of scale with the way that people are coming into Florida. We should be able to provide the services we're providing with some economy of scale. So the real goal is to reduce per capita.
Speaker, one of the things that hasn't come up in any of the speeches today is election reform. We just got through an election season that was highly controversial, went to 3 recounts. There's a big bill up in the Senate today that would address a lot of the concerns. What are your thoughts on election reform and that bill in particular?
Well, I haven't seen the details of that bill in particular. My thoughts have always been that a lot of what went wrong during the election already had laws that applied to it. We just had people that were not following the law. Now, if there are some adjustments that can be made that can improve that, then I'm open to those types of ideas. But often what we have to see is during a situation like that, where there are laws already in place, and in a lot of ways there were a lot of laws there in place. So I think some adjustments may be helpful, but I don't know that sweeping reform is necessary.
You targeted higher education spending in your comments earlier today. The governor has some pretty different things to say about university spending. Can you talk to us a little bit about the differences you between yourself and the governor on that front?
I think it's really more of a matter of perception. I think I tried to make sure that everyone understood that our university system is one of the best in the nation. But also there's a tremendous amount of waste within that system. The priorities have not been, in my view, aligned with the students' priorities. And there's a lot of money there. There are also a lot of outstanding obligations that we have to look at as well. I think that we can create a stronger, better, more viable university system without just throwing more money at it. The carryovers of these universities are over $1 billion. Sometimes they don't even know how to spend the money. We throw so much of it at them.
Do you think the budgets of the last few years where the Senate pushed for more money into the university system, paper, lead faculty, that sort of the thing that the House agreed to get its basically home scholarship, that sort of funding, is part of that?
I think all spending is part of it, and yes, it's been my my view that the more money that you throw into an institution and the faster that you throw it in there, the less that it can properly assimilate it. And I think that that's what happened in the university system. I think we've thrown tons of money there. We've seen growth in the areas that we don't necessarily want to see growth, and we've seen a divergent set of priorities from those of the student. I think I think a course correction is needed. It's not sweeping reform, but it's certainly a course correction.
You mentioned in January that you support a ban on fracking. There's legislation moving in the Senate that would only ban hydraulic fracking. The environmentalists are supporting other bills in the House and Senate that ban all unconventional forms of well stimulation. Do you support just a ban on hydraulic fracturing or the wider ban on unconventional forms?
I think that the House's position has been that we support a ban on fracking. For years, the conversations that we have been having and trying to get done is a study to really understand what are the issues associated with this. So this year, in spite of banning fracking, we're still going to push forward with the idea of a study. We'd like to understand what these other types of fracking can do.
Mr. Speaker.
You said that you supported lowering drug costs. I know that Governor Ron DeSantis backs House Bill 19 that would establish a drug importation program from Canada. Is that also your idea that you were referring to in your speech this morning? And, did you advise on that legislation at all?
Yeah, we had conversations about some of the issues around healthcare and also prescription medications. So there is an existing law, 2003 Drug Modernization Act, that allows for individuals to be able to purchase drugs from Canada. There's also within that the ability for certain distributors, if they get certified by the Secretary of HHS, to also be able to import drugs. But in 16 years, not a single one has been approved. So what we're trying to do is, within that framework, push to be able to have distributors certified so that they can import drugs. But beyond that, we want to be able to do what in a lot of ways has been done in marijuana, which is to say, if we establish a safe environment and we can guarantee the safety of the people buying these medications, why should Floridians have to subsidize the world's drugs? Why can they not buy them, in some cases at 1/10 of the price, the same exact brand name drug?
Quick follow-up, what do you say to some of the conservative, criticism of that, other countries subsidize drug prices or have price ceilings on drug costs, and so by purchasing from other countries, you're actually not abiding by free market principles, that America is the only place with free market principles when it comes to drug prices?
Well, there are no free market principles when you cannot go out and explore the entire market. People are absolutely constrained to the market that they can purchase in. As a result of that, the prices are set the way they are. Add to that the federal problems of protecting the types of patents that are protected on these drugs, re-upping them every so many years, and you end up with drugs whose prices are just simply astronomical. I don't think that that's free market. If you really want to break open a free market, you set up a global market for medications. If they're brand name medications, if they're FDA approved, and if we can guarantee that during their importation, then we can establish a real free market.
Speaker Oliva.
The Senate President, he did seem a little concerned about the proposal. House Bill 19 has a bifurcated system, one that would allow for the state purchasing and one for individuals, while Gavano seemed very supportive of the portion that would allow you to purchase the drugs through lock-in and corrections. He said he had concerns about interstate commerce and that is not something that the legislature can do, that is something that is at the congressional level, and that he was worried about the side that would allow the individuals to get the same benefits as the state would get.
Well, I think it's a legitimate concern, but the same can be said about marijuana, which is still federally legal, and here we are legislating it.
Mr. Speaker, beyond fracking, do you support any other environmental regulations, like regulations on septic tanks, which the Republican Party of Florida chairman is pushing, or anything else to limit nutrient pollution that contributes to algae blooms?
Yeah, I think the answer is yes. The question is, how do we do it within our principles? We simply can't go and impose upon all of these people in all of their homes now some tremendous cost to have to tie in to a different system. But we do know that there are septic technologies that allow for water to emerge from the septic system much cleaner than the current septic systems. I think that water quality in general, as you know, is a comprehensive approach, and every little bit that we can do will help. The levels of nitrogen that are found in those waters as a result of leaky septic tanks is a major concern, and we have to address it.
Mr. Speaker,
Oliva.
Ana Cuervo with Telemundo in Miami. If you could please reply a question in Spanish.
We'll do my best.
Home in Miami-Dade.
Why didn't they do this to Corcoran?
Regarding public schools and charter schools, la carta que escribió pidiendo que se distribuyan los fondos aprobados por los votantes para aumentar los sueldos de los maestros, muchos pensaban que para los maestros de las escuelas públicas. Escribió esa carta para que se distribuyan esos fondos para todos los maestros. ¿Es justo cambiar eso ahora?
Bueno, lo único que estamos pidiendo es que sean para todos los maestros de las escuelas públicas. Hay escuelas públicas tradicionales y hay escuelas públicas que se consideran charter schools. Esas no son escuelas privadas. Es decir, los salarios de esas maestras vienen de los fondos de los contribuyentes. Esas escuelas también son públicas.
¿Y cree que se debe utilizar fondos públicos para becas para escuelas privadas?
Fondos para becas. Yo pienso que eventualmente todos los fondos que se usan para una educación de un niño deben de seguir a ese niño. Es decir, darle la mayor opción a un niño y a sus padres de determinar a qué escuela va a atender, donde sea.
Y una más, ¿cree que el tránsito puede ser mejor manejado a nivel estatal? El tránsito en Miami-Dade era una propuesta para disolver MGX. ¿Cree que el Estado lo puede hacer mejor?
Bueno, en este momento lo que estamos es muy descontentos con la manera que se está haciendo. Yo pienso que si no podemos rebajar los tolls que se están viendo en esas carreteras y vemos que se están acumulando fondos, tiene que haber algún cambio de liderazgo ahí.
Mr. Speaker,
Can I ask
two
you to
quick
expand
unrelated
on that a
questions.
little bit
Do you
with,
support the bill
education?
for pharmacists to treat flu symptoms?
Mhm.
Do you support that or oppose it?
I think that everyone should be allowed to practice to the full extent of their education. I don't think that we should determine whether something is safe because another group considers that it's safe or not. If people have been formally trained and they have had the right education, then they should practice to the full extent of that, whatever that is.
Okay,
Can I
and
ask
a
you
quick
to
follow-up,
expand a
which
little
is,
bit?
are we going to move a sports betting bill this year?
You know, we haven't seen anything yet, and you know how gaming is in the legislature.
I do.
It starts with great promise, and then it somehow seems to get mired in all its details. But I would hope, as I have in years past, that we would be able to finally bring some sort of settlement to an issue that's gone on for years.
Say,
Follow up on those conversations about tax credit scholarships and teacher pay raises, including charter schools. Can you expand on what you envision the tax credit and scholarships look like to your house?
Well, I think that it's very similar to what you've seen the Senate roll out. I think what we would like to see, though, is also the opportunity for, in years to come, to continue to be able to expand. Ultimately, the money should follow the child. The choices that are made for that child and what school they attend should be made by their parents. And in order to truly have a system that allows for full choice, then the money ultimately has to follow that child, and the parents get to make the decision of where that child goes to school.
You would
Can we-
envision this as being sort of the first step toward an education savings account?
Well, look,
To challenge, face a challenge in this.
Yeah, I think we're celebrating the 20th anniversary of the first step towards an education savings account. And I think throughout the 20 years, during those 2 decades, there have been numerous attempts, and of course there have been legal fights and political fights. But I think ultimately, we've always been very clear. We feel that the money should follow the student.
This Supreme Court may be a little more friendly toward that idea. you would say.
I do not speak for the Supreme Court.
But if we could follow up on that, there's a couple of key concepts to ask about that. First off is the issue of regarding the money following the child and what have you. You mentioned economies of scale at the beginning when you're talking about universities and things of that nature. So why shouldn't there be economy of scales in that tax credit scholarship program? Why does one particular vendor continue to get 3% of every scholarship? Shouldn't they be able to get to a point where they could maybe take some savings from what they're getting and apply it to more children? And then on top of that, are you all going to continue to have a policy in which if you accept this voucher or the new voucher that's being proposed, would there be any consideration to tell the schools if you want to participate, you can't charge tuition beyond the amount of the scholarship?
Okay, so the first question, to answer your first question, the answer would be yes. We are open to anything that allows for economies of scales, greater savings for the state and the taxpayer, so long as the service is being provided at the same level of quality. With regards to your second question, it would be tremendously punitive to tell schools this is the only thing you can charge. It would somewhat get us back to the same situation that we started to try to get away from to begin with, and that is to say that we tell you what it is that you have to do.
But if it is about the parent and it's about helping people who don't otherwise have a choice, I mean, in essence, aren't you kind of just subsidizing a private school when you say, oh, yeah, we'll give you part of the education cost, but that school still has the opportunity to raise tuition above what the state is giving them?
But we're not having the discussion with that school, we're having the discussion with the parent. So you have a child that is not doing well in a school for whatever reason, and you have a parent that feels, I would like to take this child and the money that goes with him or her and take it to another school. why should we get involved in the discussion about what that other school is or what that other school charges? What we know is that the taxpayer commitment to that is what it is. We won't pay beyond that, but why would we go and tell someone that now you have to offer your services at these prices?
Two more, guys.
Then quickly, I wanted to know about, is the House going to continue the $98 million reduction that's in this year's budget for Medicaid because of the change on retroactive eligibility?
We have not made that decision yet. We're still crafting the budget.
And then just a quick follow-up. The governor today talked about wanting to share savings, the importance of transparency, how the state has a transparency website. You all created that a couple of years ago, passed an all-payer claims database bill. None of your domestic insurers are reporting that information. So when you go to that site, it's not maybe giving you the information that you think is there. Any concerns about that? Anything that needs to be done?
So as we discussed, in order to truly reform healthcare, it has to be tremendously comprehensive. That means that you have to create an environment where information is known, where transparency and pricing exist, where you have accountability in estimates, and then you have to have people having the ability to participate in that. Until the consumer participates in what kind of health care they get and what they pay for it, we won't truly see the market conditions apply as they should. So it is a concern anytime that we cannot generate the kind of information that we think is vital to the system.
Thank you.
But nursing home and hospice have been saying that they'd like to be exempted from that bill, which we represent this hearing. Would you be open to getting rid of nursing homes and hospice from your COVID case?
Well, I think almost everyone said they'd like to be exempted from that bill. I think we are starting with the premise that certificates of need have not been helpful. This bill has to go through the process, and it has to go through the Senate, and we have to have a conversation about it. I don't know where the bill will end up, but I know that it must end up in a place that is meaningful and prevents the monopolies that we created through those policies. Thank you.
Thank you.